Hello everybody, good morning. My name is Lamia Diaji. I'm a pharmacist and I want to discuss my journal club presentation about rivaroxaban with or without aspirin in stable cardiovascular disease. This study published in the New England Journal of Medicine with impact factor 176,082. The aim of this study is to test the hypothesis that rivaroxaban with or without aspirin is more effective than aspirin alone in preventing recurrent cardiovascular events with acceptable safety in patients with stable atherosclerotic vascular disease. About 10% of cardiovascular disease patients have recurrent events each year, even when aspirin used as an effective secondary prevention. In this study, they decided to add rivaroxaban with or without aspirin and comparing it with aspirin alone to prevent recurrence events in these patients. Rivaroxaban is a selective direct factor XA inhibitor used to prevent and treat venous thromboembolism, stroke, or systemic embolism in atrial fibrillation. Double-blind randomized trial was performed in this study among 27,395 stable atherosclerotic vascular disease patients. They divided into three groups. The first group was 9,152 patients who received 2.5 milligram rivaroxaban BID plus 100 milligram aspirin once daily. The second group was 9,177 patients received rivaroxaban 5 milligram BID. And the last group was 9,126 patients with aspirin alone 100 milligram once daily. The eligibility or inclusion and exclusion criteria in this study. Let me begin with the inclusion. Every participant must have written informed consent and must meet the criteria for coronary artery disease or peripheral articular disease or both. And the patient with coronary artery disease must be less than 65 years old. And about the exclusion criteria, any patient with high bleeding risk was excluded from this study, or any patient with recent stroke or previous hemorrhagic or lacunar stroke was excluded, and any patient with severe heart failure, any patient with estimated glomerular filtration rate less than 15 milliliter per minute, and any patient used the dual antiplatelet, anticoagulation, or other antithrombotics. These are the outcomes that were investigated in this study: primary, secondary, and tertiary efficacy outcomes. And this is a slide about the PCAS in this study. P was the patient with stable atherosclerotic vascular disease. I was the rivaroxaban with or without aspirin, is comparing with aspirin alone. And the outcome in this study was significant benefit of combination therapy that I will discuss later. And the S is double-blind randomized trial. This is the type of study. Okay, in the result section, we can notice that aspirin alone compared with combination with rivaroxaban. The primary, secondary, and stroke are significantly reduced with combination. But when comparing aspirin alone with rivaroxaban alone, we noticed that there is no significantly reduced in risk of major adverse cardiovascular events. And in this chart, the black line represents the aspirin plus rivaroxaban combination, and we can notice that there was a reduced in adverse cardiovascular events compared to each medicine alone or each product alone. Here in the last table, in this section, we can notice that, unfortunately, there are significantly high risk of bleeding with both the combination and rivaroxaban alone when compared with aspirin alone. So we conclude that the adverse cardiovascular outcomes was significantly reduced with combination, but the bleeding was significantly high with this combination. Okay, that's all. Thank you for your listening. See you soon. Goodbye.